There's some cool things over here, to be honest with you. So, I think a lot of people hear aesthetic medicine, and then they think luxury, glamour, this is going to cost way too much. This is for the people who are vain. It's focused in vanity. It's used to be very hush-hush. People would be like,
Yeah.
I don't get anything done.
Liar.
Yeah, excuse me. You do. And it's actually about visibility and restoration, I think.
Sure. I mean, we've had patients who've survived car accidents, burns, skin cancer surgeries, even animal bites. And they come to us not only for filler or laser, but for a piece of themselves back.
Yes, 100%.
Yeah.
It's emotional healing.
Yeah.
I think. When someone looks in the mirror and finally sees what they actually feel on the inside and see themselves again after a trauma or an illness, it's very, very powerful. And we've seen people cry right in the chair. I mean, multiple times. And it's not because of the needle. It's because they recognize themselves again, or they just don't feel like they look tired or they're not themselves.
Yeah. And I think it's a kind of a release too for them.
Yeah.
Once they see themselves in the mirror, they're like, oh, yes,
Yes.
you brought me back.
I agree.
It's actually an honor to be able to give this to our patients. Helping them feel like themselves again after everything they've been through. That's what's inspired us to take this work even further, people.
I didn't mean to X you. I meant to siren you.
Yeah.
So introducing the CQ
Cares
Foundation. So we are proud to officially announce the launch of our foundation, the CQ Cares. It's something that's been on our hearts for a long time. Some of you may know about it, but we're here to talk to you all about it today.
Yeah, CQ Cares was born on the belief that everybody deserves the chance to feel confident and whole.
Yeah.
Even if insurance says,
insurance.
Can't have it. Yeah, big downer. I mean, so many patients we've had.
They're like, oh, cosmetic? Oh, you want a little more money than it would take to do, I don't know, a hypertension med? I don't know. It's just dumb.
Forget it, because they know, oh, this is for youth. Well, not always.
Forget it. Forget about it.
Yep.
So we're focusing on life-changing aesthetic procedures that can make an enormous decisions.
Enormous.
Thank you.
You're welcome.
What she said, difference, but often aren't covered. So these are things that include congenital birth defects, cancer-related changes, domestic violence injuries, animal bites, scars from burns or accidents, disfigurement from skin cancer removals. And it's not just about the physical recovery like we were just talking about.
Yeah.
It's emotional as well.
Yeah.
So once a quarter, we're going to be selecting someone from the community who gives a lot to others, but also may not necessarily be taking in the self-care that they should be.
Sure.
So think of non-for-profit leaders, teachers, medical staff, veterans, caregivers, first responders. That's what we'll be thinking of. And then we will also have some other things up our sleeve for the foundation.
We want to basically give those people a day that's all about them. Because these people, they don't, like you said, they don't think about themselves. They're thinking about everybody else. So self-care, confidence, love.
Yes.
We'll put you in our arms and we'll rock you back and forth. I don't know.
I mean, yeah.
We'll
do that if you want that, but I don't know.
We want to make them feel
We don't have a float tank or anything cool to like do that with, but.
Next time you see me in my room.
Okay.
Okay.
All right, the sparkle box. This next part might be my favorite. Tell us all about the sparkle box and how it kind of came into fruition.
So the sparkle box started as just a glimmer of an idea about 5 years ago. Your sound effects today are on point.
Yeah, I can't say enormous, but I can do sound effects.
Sound effects is perfect.
Great.
It all began with our patients who had experienced that trauma, birth defect, cancer, unfortunate loss. And I'll never forget that one woman. You helped me with her. She came in, she was hit by a drunk driver. The drunk driver drove away
So crazy.
and left her, unfortunately, with some severe facial injuries that to
Disfigured
her felt
Yeah.
very disfiguring. Oh no, I can't
An
talk.
enormous disfigurement.
But anyways, with your help, we developed this wonderful plan. Unfortunately, it involved a lot of syringes,
Yeah.
and that all cost money. And we just wanted to give it to her because she went through all of this. Why should she have to go even further and spend all of this money when
It was no fault of her own.
Correct.
And like this was something that we could see. It's something that's tangible, something we could fix,
Yep.
something insurance would not cover, and because it's cosmetic in nature.
Yeah.
And then our higher ups, we went to them and said, we want to donate our time and we want to give them this product. And they said, nope, these are the people that should pay even more money. These are the people that will pay more money to have their face fixed.
I mean, that's
because it's all effed up. And the only thing we say F up is cancer. F cancer.
F it.
F a lot of things, but F cancer.
But that didn't sit right with us, so we were like, okay, let's do something special for these people. So with the help from our wonderful reps, we were able to create this sparkle box.
Yes, and so it's our way of wrapping someone in a little community and care. It's filled with little luxuries, self-care items, and maybe even a treatment or a product donation from our local partners. A little reminder that they still sparkle. They still have that shine in them. We just need to bring it forward and kind of put those insecurities at bay and help smooth things out a little if they've had some evidence of facial trauma. You know?
Yeah. So starting January 1
of 2026.
Wow, that's wild to say.
Whoop, whoop.
You'll be able to nominate somebody.
Or apply
for yourself. Correct.
Donations
are welcome, and if you can even
enormous disfigurement. You can even
sponsor someone directly.
Yeah, so like we love the idea of giving back. We always do it. We've given away it's almost close to $1 million that we've given away since we've been open, which is crazy because for the longest time we kept saying it's $640,000 we've given away. But upon our last update, like we literally have given away almost $1 million in product, treatment, stuff like that for our friends, family, community members. And they'll fight us on it. Sometimes they try to throw cash at us and run away, but we really love doing that. It gives us selfishly some good vibes to do that. I feel good about giving back to these people. And so I always say if we have money to pay the bills and pay ourselves, then we're just fine. So we can do these things. But I think it's really amazing that when you pay it forward, like when you go to a restaurant and you're able to like, take off a little receipt, not a receipt, like they write the things on. What do they write them on? A pad. They take your order.
Yeah.
You can like take an order down and pay for it to prepay it.
Yeah, I know.
You know what I mean?
Yeah.
And, and then somebody comes in and they're like, your meal's paid for. Like, it's happened to me a couple times. I'm like, what do you mean my meal's paid for? That can't be right. That's not
Or in
me.
like the drive-through, like through Dunkin'.
Yeah. And I'm like, and then I do that. And then you can like pass it along and like pay for the next one.
Yeah.
So like you'll be able to sponsor a patient or loved one this way. You'll be able to just donate so that when somebody comes in and has an application, we can just pull from that. That way it doesn't inhibit or impact our small business negatively, but also gives us the opportunity to donate our time
and give more.
Yes, absolutely. So we match a lot of things. We always try to, give to the people who ask for donations in our community. But I think this is going to be huge because not only will you be able to apply yourself if you're feeling down, but you can apply for others too, which is awesome. Because sometimes I feel like just the smallest little act of kindness, a message saying you matter, it can change how someone sees themselves in the mirror and in life in general.
Right.
So.
Right.
All right. Let's get into some real stories. Today we have two guests with us. who have inspired, honored to be joined by two incredible women who embody what the CQ cares, and who have actually had this kind of work before the foundation was even built.
Right.
And you'll be able to hear how it's impacted their lives.
Our first guest is a cancer survivor who went through some significant hair loss and some skin changes from treatment. And if you've ever had to have chemo or radiation, you know exactly what we're talking about. She's here to share how her aesthetic medicine treatments have helped her feel whole again.
All right, so without further ado, let's get her in the studio. We are back with one of my favorite people in the studio. We are live, and I found a new prop. But we are going to let you introduce yourself, Audra. So tell the people, who are you?
Hi, my name is Audra. I've been a patient of Stacey's and Jena's for a while now.
Yes.
And they put up with my crazy and give me fun nicknames.
Oh my God. Actually, what we should tell the people. I think we should.
I think we should.
So Audra came to us through verbal acknowledgement. I don't know, like friends,
Yeah,
right?
yeah.
Like through
The grapevine.
I heard it through the grapevine.
You're singing already.
This is my singing.
Oh,
You even broke the singing.
I'm gonna put these things down before I break them. So she heard through the grapevine that we were the place to be. So she came in and we instantly kind of hit it off. I do not know how this happened exactly, but somehow we started looking up swamp witches and then started, you know how?
I do.
Tell us.
I came to see you for treatment after a rainstorm when I was climbing on a ladder and fell off the ladder.
Oh my God.
So I
remember
looked like I remember,
this.
and I landed in the leaves. There were leaves everywhere, and I looked like I crawled out of the swamp. And I said, "You got to do something. I don't know." And she's like, "I can't do anything for the leaves in your hair."
And
but
then I was like,
fix the
"I do
wrinkles."
think there is a song called "The Swamp Witch." And she's like, "What?" And I'm like, "I'm gonna play it for you." So I like look it up on YouTube. So by the end of the appointment, we were singing Swanch Whips. Swanch Whips. Swanch Whips. 6-7. Lock in, folks. We were singing Swamp Witch. Say that 5 times fast. I want you, while you're in your car right now, to say that because it's really
difficult.
You're going to say Swanch Witch, and then you're going to not know what's happening.
You might say worse.
You might say.
Keep your windows rolled up.
But we were singing, and it became like a fun joke, and then our relationship just kind of evolved, okay? So I was treating her aesthetically, but just minimally, but like all of a sudden we became friends. Like I learned that she has a pet bird. Do you want to tell us about the bird?
The bird. The bird made a guest appearance for Stacey and Jena at one point. You really want me? They're gonna turn this off.
No, they're not.
No.
So you want me to
This
tell
is
the story?
No, they're not. And I think I want a bird. I follow the Green Bird
no.
Brigade on Instagram. I know you
Yes.
always
no,
say
no,
this, but they're so funny. And there's the one little bird that says,
Bacon pancakes.
bacon pancakes,
Yes.
making bacon pancakes, bacon pancakes. And then
Yeah.
some guy just goes, whisper pancakes. So if you don't know, look it up.
Yeah.
Whisper pancakes.
Ashley just got 2 birds, and they're trying very hard to make them.
She told me
Bacon
when I put something on there
They're
that I
cute.
should tell you that we need an office bird.
Oh, but they're loud and they're messy and they bite.
And then if you
Lips
let them
after-
out,
So what happened to you? Do tell.
Well,
bite.
this one time I went to see the Queen of the Swamp Witches for lip filler, and about a week in, maybe. Not even. I'm not even sure it was a full week. I
Yeah.
don't think I was fully
No.
like, don't touch it and mess with your mouth yet.
No, I think it was fresh.
Yeah.
Is it? Yeah, it was pretty
Yeah.
fresh.
Yeah, pretty fresh.
So I don't know what happened. I was laying on the couch. Molly, the bird, was sitting on my shoulder, and she ran over and latched her beak onto my lips.
She thought you had bacon pancakes in your mouth.
I don't know what she was doing, but she bit down and she almost bit through the top, and she hit the bottom, and that's why so now they're swollen right from the filler. So then I have these giant.
So I get
bite
this phone
marks.
call, and I'm like,
Wait, we're out to dinner.
we're
You're
not
like at
even
a
out to
seminar
dinner.
or
We're
something,
out
right?
to a seminar, like with one of the like most profound dermatologists in like the US, right? Who's like doing all of these new groundbreaking studies and things. And I'm
Yeah.
like, I'm sorry, I have to take this. My patient got bit by her bird. And he's like, I'm sorry, what? And I'm like, just 2 seconds, just quick timeout. So I'm like talking to her about it, and I'm like, no, I think it's gonna be okay, but I'm more worried about this.
So
And she's like, wait, you mean this? And she knew about it, and I'm like, yeah, it's a bird bacteria, because we're always taught like these species of animals have different like bacterias that you have to be worried about. So like you have to be worried about the cat scratch fever, and you got to be
You give
worried about the
Stacey
coccidia.
one fun fact, and she will think of it like 50 years from now. She'll be like,
I'm like,
yeah.
oh, I read that once. So literally, she was like, oh no, my bird's been vaccinated for that. I'm like, okay, well then carry on. We're gonna see you later. So I went back. I'm like, everything's cool. Like the woman vaccinated her bird against
Yeah,
this.
she was
So
tested, so she didn't have
Yeah,
it. But yeah,
perfect.
yeah.
perfect.
I was like, do you mean acidosis? And she's like, how do you know that?
I'm like, that is exactly what I mean.
Yep.
Right. That's how it reads.
Yeah.
For sure.
Yep.
Bird didn't have it. Anyway, I think we should still consider getting one.
Nope.
Honestly.
Nope.
No.
Don't do it.
I would love to
So
have a kid.
then we've become friends at this point. Okay, like you come in, everybody's excited to see you, your family. Most people are sitting chatting in the waiting room. Everybody kind of passes by, knows each other once in a while. So you come in and you weren't yourself, and I said, "What is going on?"
Yeah.
What happened?
I want to say, well, first, there was the time that you guys took off the funny mole, and then they told you to take more of the funny mole because it was not looking so good.
Yep.
So
Yep.
skin checks.
Yep. Because you weren't even
thank
there
you.
for the funny mole. I don't think.
No,
No.
it was after that. So we did that, and then I came in, I don't know, for like a treatment, and I was tired, and it was, I think, so it still makes me so mad, but there was such a delay at the time between finding what was coming and getting the mammogram, the ultrasound, the biopsies.
And you were frustrated. And
Yeah,
this goes back to our previous podcast where
Yeah.
Western medicine is sometimes broken, and you have to be an advocate for yourself.
Yeah, I was angry. So I was having trouble breathing when I was hiking, and I couldn't regulate my heart rate. I'd get up, and I wasn't even doing major peaks, but anything with any elevation was giving me trouble. So they did a CT scan of my lungs to try to figure out why I wasn't breathing right. And they said, well, your lungs look fine, except there's this little spot in there we don't like, so we're going to send you for a mammogram and an ultrasound. And I said, okay, great. When? 60 days later, because at that point they were so backed up. So I think I had the ultrasound and the mammogram, but not the biopsy when I came to see you guys.
Correct.
At that point.
Yes.
And that was another 30 days to get the biopsy, because of what one little spot, by the time they did the mammogram and ultrasound, had turned into what looked like 3. And really it was still one with 2 little offshoots to it, I think is how they described it, but it had gotten bigger. So I think I was in between.
I think you were too.
And I think I
think
came
you
in
were
for
too.
like normal, like a tox.
And we literally didn't know what was going on, but we knew that something was wrong. You were very frustrated with the medical teams.
Yeah.
And we didn't even know who to really blame, because I wanted to get in and I was all riled up. I'm
Yeah.
like, what do you mean? But I'm
That's
like,
the
who
witch
do-
in
I'm
ya.
like, swamp witches unite. I'm just like, I don't know what's happening here. Like, who are we mad at? Are we mad
Yeah.
at the institute for not having enough machinery?
Yeah.
Are we mad at the staffing issues? Are we mad at incompetence through the actual, doctors? Are we mad that the people that you're seeing don't know enough about what's happening? Who are we mad at? And we couldn't figure it out, but we were trying to navigate this, and I was like, keep me posted.
Yeah, so I was mad. So the doctors, in fairness, so my primary care doctor is the one who ordered the CT and found it. And they were telling them the delays in imaging, and apparently 60 days was considered quick at that point, because they just didn't
Wild.
have technicians.
Wild.
So they described it to me as, you go to a restaurant and there's 100 open tables and they make you wait an hour to eat. Well, there's only 2 servers. It's the same
Or
kind
there's
of
only
thing.
one cook.
Right. So it's the same
Or there's
kinda-
no cook, and everybody's trying to figure it out in the back.
Right. So
Ooh,
yes.
that's scary.
So same idea. So there weren't people to actually operate the machines and read. Then they had radiology problem reading the stuff. It took a little
Which
while.
is wild. So it's like a multifactorial thing, which is what we always talk about. You can't just pin the blame on one person, and you never know what everybody's experiencing, because I'm sure nobody wants this type of care,
right.
but it just becomes the perfect storm.
Yeah.
And unfortunately, the patient suffers.
Yeah.
So what was your definitive diagnosis?
So in the end of April, when we finally did the biopsy, which was, super fun. It came back triple positive breast cancer, which meant it was positive for estrogen, progesterone, and something called HER2, which is a protein. So it was classified as a grade 3. They sent me,
And do you agree that because of you pressing and because of you being your own advocate, that led to an even quicker turnaround? Because I think otherwise you would have gone without this diagnosis a lot longer.
Yeah, I feel like in the beginning they didn't seem too concerned about it, so I wasn't either. And that
Right.
60-day time frame, looking back on it, I would say, I'll travel, send me somewhere else, send me Albany, send me New York, wherever you need to go to get those tests done so that you can move it quicker, because it had enough time at that point. By the time we got through to the biopsy and they sent me that, then it started moving very, very quickly. I went to the surgeon, the oncologist. It was all within days. It was whirlwind. And I had leg surgery on top of that. So 2 days
Yeah.
after my diagnosis,
Yeah.
I had leg surgery, and the vascular people were like, whoa, we're gonna do less than we thought, just to see,
Yeah.
give you a chance.
I remember all that.
Yeah. So but by the time I got to the surgeon, it wasn't huge, but it took up enough of a space that if we were going to try to do breast conserving surgery, we needed to shrink it first. So she wanted me to go talk to oncology, possibly do chemo, or there's targeted drugs for that particular type of cancer, and they weren't sure what the plan was going to be.
Right.
So, but then the surgeon suspected, you know what, it's been so long since this has been in there percolating. Let's make sure there's nothing else going on. So she ordered an MRI, and then it showed up in a lymph node. So it was another 30 days to get a biopsy on the lymph node.
And like knowing you have these things going on in your own body and not being able, like I'm the most impatient person that you will ever meet. Like my parents constantly, and probably Jenna too, are like, patience is a virtue, Stacey, like patience. But like knowing that had to wear on you.
Yeah.
So I have the patience of a half-dead fruit fly.
I can't. This is perfect. Like, this is what we deal with when you come in.
Right.
Love
Yes,
this.
I know. It's like sitting. You know the fruit fly that's in your
Yes.
drink and it gets out somehow and it's crawling along the table
Yeah.
and it's like that's kind of I'm crawling along the table. So in between, I decided I need extra opinions on this, and I went and saw people at Upstate, and I went out to a team in Boston. And
But this wasn't offered to you. You had to seek this out.
Yes. So I think I will check and research and be kind of, I don't know what the right word is. Not like pushy or aggressive, but I'll kind of just keep following up.
But I think that that's a good thing. And we've talked about this before. Like you
Yeah.
and I have had really good conversations about certain aesthetic treatments or things. And you've said to me, I don't mean to overstep. I don't mean to,
Right.
I obviously trust you or I wouldn't be here, but I was just wondering, could you talk to me about this? Or
Yep.
have you seen this study?
Yep.
And like, those are the patients we love to have because
Yeah.
this is your body. This is still medicine. And I think everybody should be educated. And you know that I talk until I'm blue in the face.
Yeah.
Or half dead fruit fly. I'm not sure which one. But you know what I mean? I think that that's important that you do your own research. And I mean, we've had people on the show. Deanna is one of the best researchers I've ever met in my entire life. And she's probably schooled me and other medical professionals on certain areas more than anybody who has actually taught me medicine before.
Yeah.
And that's because she does such thorough research and the research is out there, but it's hard to dig through, it's hard to look at. And so I give you huge props for doing that because that's not a flaw.
Yeah.
It's actually a strength.
Absolutely.
So my one big piece of advice on this, though, is if you do your own research, stay off of things like Reddit. And what's the other one that starts with a Q?
WebMD, Quizmia.
I mean, WebMD's better than Reddit, but
Yeah.
I tried to make sure.
Quora.
Yeah, that's it. I
Yeah.
think it's that. There's another one too out there.
Quizmia is a weight loss drug.
It's fine.
I don't know what I'm talking about
That's
today.
apparently in your eye right now.
I'm the fruit fly flew in there.
So when I did it, I
I
would
really
go,
like this, Stacey. I'm gonna say it.
What?
I like this, Stacey.
You like this, Stacey?
Mhm.
The weird one with the fruit fly in
Yeah.
it? Okay, cool.
That's a fruit fly in her eye.
Okay. Anyway,
Like a
the
piece
half
of pie.
asleep.
Woke up on the wrong side of
I'm
bed.
not even intoxicated. When I was younger, though, my parents used to say all the time, "Are you drunk? This is just me.
Like,
I
no.
am.
Deal with it." So stay off, stick to evidence-based medicine, stick to
Yeah.
the journals, stick to the actual, and we tell people that all the time. Like
time.
if one more patient comes in and tells me, well, TikTok said,
Oh, yeah,
I'm like,
yeah.
I don't want to listen to you.
Well, and
Okay.
it's dangerous
And now with
too.
AI,
Sure,
I feel
yeah.
like that's opened a whole nother box because
Yes.
AI is great when used with, specific parameters and in certain guidelines. But
Right.
when you start asking it medical questions and it doesn't know where it's pulling from or it doesn't know where it can't pull from, that can be dangerous.
Yeah.
Absolutely.
Yeah. So, but the funny thing about the medical journals is I would try to read them. And I'd have to have Google open to Google the
But
words. I
you
don't know
were
what that
good
is.
about it.
I was trying.
I mean,
you
she'd
know.
come in, she'd be like, and I researched this, and there's this new drug that just came out of Tokyo that, and I'm like, what? And then I'd look it up and I'd be like, she's absolutely right. She's like, we don't have access to it here. I'm like, of course we don't.
Right. Yeah.
I'm like, why do we live? No, I'm kidding.
But then when I would go and talk to the doctors, they were all great. Once I got into the actual treatment, all the people I didn't go see, the ones who gave the second opinions, some of them worked with the doctors here, so I kind of had a whole team.
Good
Yeah.
team, yeah.
And
So,
some of
yeah.
the things that you brought up to them, they actually adopted into your medical care plan. I know, like, when you wanted when your side effects were getting so bad that it was affecting your quality of life,
Yeah.
you brought to them a study that actually said, listen, the actual endpoints are almost the same. I don't want to do this.
Yeah.
And they were like, okay, we're with you. So,
Yeah.
like, that was kind of a cool thing. I mean,
Yeah, it's
Well, they
very
had,
cool.
Yeah, they had alternatives.
Dr. Audra in the house.
Well, no, I
What's that?
I didn't. It's a fine line because you don't want to not do the treatment, but at the same time, if you can't, like for me, there's a portion of the treatment that happened afterwards. It's the aromatase inhibitor drugs that caused really bad joint pain, and it was like walking on golf balls filled with glass. I just couldn't walk.
Oh my God.
So there's 3 different drugs if you're postmenopausal. Lucky me. And we tried them all, and they all varying degrees of evil. So one
Sure.
was really bad, one wasn't quite so bad, but wasn't great, and then one was kind of between them. So, but they were still not great.
Yeah.
So they tried a 4th drug that's typically used for premenopausal women just to see what would happen. And that one I survived a little bit longer on. But for that one, they knew that I had this idea of wanting to take it in lesser dosing and every other day. So the oncologist said, listen, we can try this one at a half the dose every other day and see how it goes. And it's not exactly your type of cancer that we do that with, but there is a study out there that's underway, and they're doing it for this type, and we'll have to
They
extrapolate
met you
from
where
that.
you were at.
Yeah, and they were willing to do it. So I feel like if you're not, the worst thing you can do is suffer and not tell them. And I was guilty of it during the chemo portion. The chemo was really bad too. I don't wish that on anybody, but I wouldn't say anything because I didn't want to, I didn't know what to do.
Yeah.
And they said, why didn't you call us? Why didn't you come in? Why didn't you? There's things we can do. We can do IVs. We can do vitamins. We can do all kinds of things.
Yeah.
But you have to tell us. We're not psychic.
Right. And I
So,
think that's
sure.
a huge thing. Thank you for sharing that. And the strength that you have to tell this journey is really important. And I think that's why I'm so grateful that you wanted to come on our podcast, because nobody talks about this shit, right?
Yeah.
F cancer.
We do.
Nobody talks about it.
We do.
Yeah. I think that it becomes so commonplace. Okay, like everybody's like, oh well, this person has cancer now, this person, and we were just having this discussion.
Yeah.
We're kind of skipping ahead a little bit, but I think this ties in nicely here. When you're going through cancer, people come out of the woodwork, right? They want to make sure you're okay, or they make sure at the beginning, but then they kind of forget that you're going through it. And then if the cancer treatments are successful,
Mhm.
and then you've made it through that, and you're actually considered a cancer survivor, right? And I know you don't like the word warrior because you can tell the people, but I think
Tell the people.
you tell the people. But I think at the end, people forget all of this wrath that has happened to your body
Yeah.
and to your emotions, to your soul,
Mhm.
and they just say, oh, well, Audra, you're cured. You don't have cancer anymore. Congrats. And they just move on, and just like, it's like not like they forget, but it's
Right.
almost like they just treat you like you're normal again. And you're like, wait a minute, I still am suffering from all the ramifications that this disease process took a toll on for me.
And I was never normal, so I don't know. But
I mean,
so define normal, I guess. I don't know. But yeah, and I don't think it's. Part of it is that it's becoming so common and everyone knows someone, if either really close to you or you yourself. So I think that's a little bit of it. But I also think you start to look better, you start to feel better, you start to be getting back into your normal routine. And I think that people just don't understand that underneath all of that is still, like I still don't sleep. I still have joint pain. I wake up in the morning, it's like I'm 100 years old.
You still have to decide, am I going to take the drug that makes me feel like absolute arse? Or am I
Yeah.
going to, be a half dead fruit fly? Or am I going to actually, have a chance that this could reoccur? I mean, that's got to be in the back of your mind. Like, this could reoccur if I don't take these medications the way that they were meant to be taken, but I have to live my life.
Yeah.
So, I mean, this is a lot. It's a lot. So when you came in, I mean, I bugged you a whole lot. But I think when you came in, your sparkle was dulling a little. And I don't blame you. I mean, Jesus, that was a lot to be going through.
Yeah.
And I'm sure the bird was not super helpful. I mean, at least Molly didn't bite you again, but
true. That is
not
true.
super helpful. So, what did it feel like to see your skin and hair change during your treatment? Because you talked about this with me when you came in.
Yeah, so I remember asking them, so is my hair going to fall out? And they said, yeah, it's going to. I was on 2 targeted drugs, 2 chemotherapies, so every 3 weeks, 6 treatments every 3 weeks. 6 every 3, right? And it was an all-day event. It would start in the morning and would go in the afternoon. So I asked them, all right, so when and how am I going to know? And what am I going to look for? So they said, you'll know because the back of your hair, like the crown of your head, is going to start to hurt. It's going to feel like you have a bad sunburn.
Okay.
And it's not necessarily going to be itchy, but it'll be painful to the touch. So sure enough, after the first treatment, I would say maybe 2 weeks afterwards, my poor friends and family. I was sitting at my desk pulling hair out because it hurt. So I was pulling it out and kind of piling it up on a paper.
That's what they get. That's sorry.
I mean, can you imagine? And
You didn't tell me that part, but like I would totally do something like that. I'd be like, and here's a little pile of it. Like,
I mean, and I better pull from the other side now, right? And I'm trying to do what I'm doing, and people are horrified by this. I'm not even blinking by it. So I said to a friend of mine, I threw it out. Like, I probably should not do that here. I should stop this.
You're like, I'm saving it to make a Brillo pad.
Like
soft at that time.
One of those things you weave and put your soap in.
Yeah.
Oh my God.
A loofah.
Loofah.
A loofah.
A loofah.
You've been kind of hair loofah.
Human hair, yeah.
It was kind of loofah-like at that point. It was like all dried out and everything. So my friend said, all right, stop. I'll come over. We won't take it straight to the scalp because that'll hurt more. So we'll do I think she did a number 3 clipper. Mm-hmm. And the morning she came over, I went in the bathroom and I just, those like revenge movies where the women are chopping their hair off.
Yeah.
Looking like,
Britney Spears.
Yes. Well,
I love her, but she's lost her mind. It's fine.
So I took scissors and was just doing random cuts around my head. So I had this wacky, crazy thing going on, right? So I unlocked the front door and I texted my friend. I said, just let yourself in. So she walks in and I peek around the corner at her and I'm like, and she goes, what did you do? And I said, well, you're taping it off anyway. I thought I'd have some fun.
Yeah.
She's like, I don't understand why you're not more upset about this. I said, because it hurts. It's got to go. Like it was at that point.
And I mean, I can't even fathom, like they say, like when you have the flu or something, like the hair on your head hurts. But I can't imagine having that be like your reality every day.
Yeah. But it went away as soon as we took it off. And then my hair was really gray underneath and like a little Brillo pad. I'm like, ooh.
Yeah, you came in.
I'm like, ooh.
And how'd you feel about that? You were managing it with humor. You were coping with it because it wasn't as painful. But like deep down, how did it feel?
So as time went, the rest of what was up there started to fall out. And I had like the Charlie Brown hair. There were like 3 little hairs in the back. It was ridiculous. 3 little hairs in the back, and I had a colic back there. And one of them
sounds really sexy.
Literally sat on my head straight out to the side.
Sounds like some of my Tinder dates, like that, like pop up on my swipe left or right, and I'm like, ooh, I could like dwiddle it, like 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 that.
God. And one was like a little wiry pigtail kind of thing.
Oh.
And then so on top of that, so now I had these red splotches for some reason. That's how my sort of scalp reacted. And then my face turned And you guys saw the pictures. I was
Ashen.
comparing myself to like
Yeah.
Gollum, and I was having, because that's what I look like. I mean, Swamp
She
Witch
was
meets Gollum. It was
Swamp
bad.
Witch meets Charlie Brown meets Gollum meets half-dead fruit fly. It was not looking great.
All the above.
Yeah, it was bad. So,
And to us, she looked herself. You still looked beautiful.
but you didn't see me during chemo.
No,
You saw the
ca-
pictures,
You
though.
came in right after.
Yeah.
But you looked drained.
Yeah,
You looked as if
exhausted.
all the blood had been drained from your body,
Yeah.
and you had been looked at by Medusa, like
Oh, I
Yeah.
was Medusa.
ashen, gray.
Yeah.
Yeah.
We saw you when you didn't have hair.
Yeah.
You were wearing that funky, cool hat.
Mm-hmm. Oh, the hat
and
with the hair, yes.
and I said to you, how are you managing? And you just kind of broke down a little bit.
Yeah, because so all these things are happening to your body, and you have all this medical stuff, and you're going appointment to appointment, and you're trying to get through what's going to hopefully get you to surgery and have a clear result at surgery, so you don't have to do chemo again.
Sure.
You're
Yeah.
hoping that part is over. So you're trying to keep, it's very much a day-to-day sort of thing, and looking too far ahead was overwhelming. But then when you get up and you look in the mirror and you're, the steroids, they put you on steroids before the chemo for lots of reasons. If you didn't have them, you'd suffer worse. So all the things that they're giving you to manage what's coming and what the side effects are going to look like, you need them, but they wreak havoc.
Right.
So steroids, people have been on steroids, they know what they do to you.
Yeah.
Yep.
So there's that. There's
So then we're combating extra weight. We're
Yes.
combating, retained fluid. We're,
Yeah. Face.
swelling.
Yeah.
mood swings.
Oh, mood swings.
So hungry.
Starving, Marvin. And
Can you tell I've been on them?
Yeah. I
and
mean,
we haven't even touched base on the financial impact of these things, because you would think, oh, you have cancer, insurance will cover that. No, nice try. And because you want to go to these people, and this is out of network and in network, and this drug is super expensive, and they're only going to cover part of this. So when you got to me, I'm like, the last thing I'm going to do is charge my friend now, my bird-bitten swamp sister,
I feel like this is going on a t-shirt.
for
We've talked about
for
it.
a treatment that might help her feel a little better. Like,
Yeah.
what?
Yeah.
And so I told her, listen, we got this new cool laser. It helps regrow hair. It won't hurt your hair. It may not help you. It's not really studied. People don't really do this on people who are struggling with like cancer, situations. They don't pay the money for this, but it won't hurt you. Let's give it a whirl. So we did.
We did.
And your next was, my skin texture has changed. The chemo
Yeah.
has like, the radiation chemo has like changed things. I have, tattooed marks where the radiation was. And I'm like, dude, let's get rid of them so it's not a constant reminder. That's next on our docket, right? Like we're gonna go through this. And then she tries to pay, and I'm like, I can't take your money. No.
Your money's no good here.
No good here. And I say to Jenna, do you want to take her money? And she says, yeah, give me the money. No. She says, 6'7", 6'7", lock in. No, I don't want to take her
Oh my
money.
God.
She goes, why are you even asking me? Duh. So, these are the things that we want to have the foundation for. We want to be able to give back to people. And I know you're super grateful. I know every single time you argue with me, and it's not negotiable.
Like, leave, get out.
Your money's no good. Yeah.
I yell at her. I'm like, I don't come here so you don't do this and don't charge me. Like,
And,
stop it.
and literally she'll say, next time I'm going to be charged, next time full price. And I'm like, okay, sure, no problem. And then I lie. So, but I feel like, do you think that this has made a little bit of a impact on you, not just being vain, but like brought you back a little bit closer to yourself before you had to go through all this struggle?
No. A lot. I wouldn't say a little. I'd say a lot.
I was like, no. Oh,
I
like,
know,
okay.
I was like,
Cut! This isn't going the way I planned.
No,
I know.
I
want to see my face when she said that, because I was just like,
You're like, what? Got you. See, Swamp Witch. See?
I'm going to play
Tricky.
that song I'm going to link it below, guys. Link below.
Oh, we poor people.
it's fine.
Yeah, no, because so you look in the mirror and things look different. Your face looks different. Your texture looks different. I swear my eyes shifted in their sockets. I don't know what was going on. You just don't look the same, and you get back to some of it. But then on top of that, like I was on hormones for a lot of years, and they took them away. So they throw you into menopause, and then you have all of that stuff too on top of it. So and that causes all kinds of trouble, right? For people who haven't gone through a health thing on top of it.
It's a whole nother podcast, guys.
Yeah. So I feel like the combination, and it's hard to say which symptoms are caused by what at this point, because it's, been a year out from the chemo, but and all that stuff, like there's discoloration and there's dark circles and there's,
And it's all stuff we can fix.
and wrinkles that weren't there. And
So
this bunny line that refuses to go away.
scrunch.
And
Is
then
it better?
It is better.
Oh,
Yeah, see, you
yeah.
got it. Look at that. She got it. So my favorite though is when I went out, I'm like, see this line that goes right across my eyes here? And she's like, yeah. And they kept using,
No,
trying to
first
use.
of all, I'm like this. I'm like, I don't see it. I really would. I mean, if you say so.
I mean, I felt like my eyes were pulling. Well, you look at
But
yourself
to
and you see
her, it
things.
was this
Yeah.
cavernous
There's the
crater.
Grand Canyon between my eyes. And I'm like, can you do something with this? So she's like, oh, a little tox. And it was still there. So I remember it was the downtown office and you're like, okay, so close your eyes. I'm like, oh, we're going to do more tox. I'm not thinking a thing of it. And she gets done. This one leaves the room.
Yeah, Jenna, peace out.
Like Jenna flees. And I'm like, what's she?
Peace.
Yep,
That's
she's
me.
gone.
That's actually me swimming.
Yeah.
Okay.
Awkward turtling away.
I'm okay, I'm going. So she said, okay, well, open your eyes. I said, oh, right. I'm looking at her, like, I close my eyes. She never has me close
Yeah.
my eyes.
Uh-huh.
She's like, can you see? I'm like,
She's like, I think so.
I'm
And I'm
like,
like,
yeah.
no problems with vision? Like, she's like, no. I'm like, great. I just did a little procedure. Can sometimes cause slight blindness.
I was like,
She's like, because I just know she had been through so much. And I know my patient, right? Like, and obviously, like, I'm going to tell her and I'm not going to do something that, like, I don't feel 100% confident in. And, I made sure I saw the bevel of the needle and that it was super superficial and that it was just tiny, tiny little aliquots pushed at a low speed and, all of these things.
This is
And
what
I know,
goes through her
and I
head
know
with every patient.
and I know how to fix it if it should be a problem. But like, I know her and I know she is Miss Google. And I know if I said to her, I can fix that for you. It sounds like this is really bothering you, but there's a chance you could go blind. It doesn't matter if I said it was a 0.00001%. She'd be like, it's going to happen to me. And I'd be like, okay. And then it wouldn't get fixed. So I knew her well enough. And I think I asked you at that time, I said, do you trust me?
yeah.
And you said, yeah. And I said, okay, do I have your permission to do what I think needs to be done here? And you said, yeah.
Yeah.
So I took that as blanket coverage to go do a procedure that might cause blindness. And it helped and it fixed it. But, she can see and everything's fine and I'm not sued and it's great.
And there's no more canyon.
And there's no more
no more cavernous sinus.
And then later she texted me, can you still see everything good? I'm like, nope, blind as a bat.
And I'm like, F you, along with the cancer.
As long as I didn't pop out of the socket.
Yeah, I have people who play jokes on me all the time. My dad pretended to have a stroke.
Which was really
not
nice.
funny. Not funny. These
on
aren't
my
funny.
birthday.
On your birthday. That's not good.
But it was funny. Jenna, my face started doing this immediately after the PRF after I left. Is this normal? And she's like, how long has it been like that,
I
Tom?
looked at Stacey and I was like,
She's
let
like-
me
he's-
do this to your dad?
She's like, well, he's like, I tried to call, but I didn't think it was a big deal. I thought maybe it's just non-lidocaine. She's like, she's looking at me, and then I could not keep it together.
I'm
so I started
sweating.
laughing.
Oh.
She like slams the door, off she
locked
goes.
it. I locked the door, locked her out of our office. Not funny,
Oh.
but kind of.
All right, let's wrap this up.
Kind of.
First of all, thank you for sharing this because your strength is just incredible. Through this whole journey, we have been huge supporters of you. We love you so, so much. You are more than just a patient to us, like many of our people are who have suffered through this year. If you guys haven't grabbed a copy of CNY Women's Magazine, Taylor Brown did a really nice article. We're here for any questions. We want to help your loved ones. We want to help you. If there's something we can do that is bothering you, that like a line in your forehead, it may make you go blind, but you won't see it then either. So
We also have other options.
I feel like you shouldn't advertise the whole blindness possibility.
but your strength and honesty are refreshing. And it's a reminder that healing comes in many forms. I know that you've had to do a lot on your own, but also I hope that we've been able to help a little bit in the journey to get you back to yourself.
A lot. Yes.
A lot.
Is there anything else you want to share with our guests?
I mean, just thank you for everything.
Oh, no, you don't have to thank us, but be an advocate for yourself. you know,
Yeah.
reach
Yeah.
out. I think a lot of us are guilty of not asking for help when we need it or not sharing
Yes.
things because we don't want to be a burden. And we
Yeah.
are always here. I always say, you're never bothered.
And especially if you're the one who people go to, if you're the go-to strength person in your group and then this happens, then people aren't going to know what to do.
Yeah.
Right.
So,
And sometimes people don't know what to say.
yes.
So I have this problem a lot, right? So I've never experienced the loss of a child. I've never experienced cancer. I've never experienced these things that people have had to go through that are tragic, right? But I want to be there for them.
Yeah.
And sometimes I just don't know what to say because I don't want to say something that's going to make it worse or seem insignificant or, you know, put shade on the situation or
Yeah.
you know, I don't want to say the wrong thing, but we are always here, and if there is a way that we can help, we
Yeah.
will move mountains to try to help.
100%. Or just come in and take a load off and get some laughs in.
I mean, some people just hang out in our office.
Yeah.
And that's like our dream. Like
100%.
we wanted a place where people could feel safe, and just sometimes people come and just do work, or they come for their appointment hours early and they're like, I just wanted to hang out. I'm like, all right, cool. People lately have been saying, oh, my office is so close to the new downtown location, I'm just going to come hang out. I'm like, okay, you better bring that cute little kid that you've been whirling around on Instagram that I haven't gotten to meet yet, you know? And that's what we want. We love our job, and it's like not work because we actually truly enjoy what we do, and we enjoy our patients. So
And Dahlia. Don't forget about Dahlia.
I didn't bring her today, and people were like losing their freaking mind.
I'm one of those people.
But she like doesn't do well with the construction guys. You don't want her little ears getting damaged.
Or rained on.
She's like,
Yeah.
so
She didn't do well the last time.
No.
But none of us did. We weren't prepared.
but she's also not super happy to be left at home with Daisy. And Daisy was like, oh, this is ruining my vacation day. So
Wait, who's Daisy?
Daisy's the other dog. Oh, I have
Please
two
don't-
dogs, guys. Link below.
You have to. She's lost a couple teeth now. She like her tongue sticks out.
This is-
She's like
this is
so much
Daisy.
cuter now that she lost those couple of teeth.
Oh no.
And then she's
Truly.
like,
I can't. Every time I
With
see
her
her,
big
I'm
eyes.
just like, I love her.
Can't you do something about that for her?
I mean,
We're gonna
like,
keep
is it
it
like
that
puppy
way.
Botox?
No, we
No.
want to keep
No.
her that way. We
She's-
like it.
my dad the other day was like, I just love her. I'm like, I know she's good. So thank you for joining us.
thank
We
you
love
so
you,
much for having
and
me.
we're continuing to be here for you.
Thank you.
Mhm.
And now our second guest has a very inspiring story. We are joined by Rebecca, aka Beck, and tell us a little bit about yourself, my friend.
Yeah, so a little bit about me is I'm a healthcare worker, so I always, have always worked a lot. My face is something that a lot of people see when they first meet me. So it's one of those things that I've always kind of been self-conscious about. I was born with some asymmetrical lip and chin areas. It was a deformity that I've had since I was a small child. It wasn't due to any injury or anything to the area. I just kind of lived with it, and as I started getting older, I started becoming more self-conscious about it, and that's when I started seeking out plastics to see if there's something that could be done about it. I had some imaging done where I thought that maybe it was like a bone area, or there was something that was going on because I was born with some asymmetry. So I ended up going to a plastic surgeon thinking maybe I can get some tissue removed or what I needed to do and just get a consultation. And when I got there, they were like, why are you going to do all that when we can just start with a little bit of filler? And I never really thought about it. Filler never really came to my mind. And then when it was introduced to me, I was like, okay, let's try it. And then progressively, it started to look more symmetrical, and I started feeling like better about it. So I continued coming back for more and more.
So, and I think we talked a lot about it at the beginning. I said, listen, like nobody is completely symmetrical. There are some risks involved with this because this is a congenital thing. This was some asymmetry that was very apparent in the chin and the lip area, correct? And I said, we don't know where the vessels are really kind of running, if they're a little bit different in that area, which I would assume they would be since this, one side was just a little bit more lifted and a little bit more pressed in than the other, which is very common in everyone. I always like to tell everybody I have one side of my smile that goes up and one side that goes down. And kind of our asymmetries are what make us special. If we were completely mirror images, we would look weird, like those celebrities that they flip on each other.
So weird.
But I think, you know, after talking with you, you said, you know, this does affect my day-to-day life. Like, you know, I look in the mirror, it's something that I see, I'm not terribly excited about it, and it's something that really bothers me. I'd like to fix it. What kind of emotional release or change did it have after you started realizing that we were making a difference and we were making headway on this symmetry?
Yeah, so a lot of times, I would always like face the camera on one side, and I would only take photos like on one side of my face. So I'd always turn my head, or I would always position myself where if I was going to take a photo, I would position my head to only show one side because it was asymmetrical, and I just didn't feel like the head-on shots were always the most appropriate. So the first time that really made a big impact for me was when we did family photos, and I
Yay.
took a family photo, and I was able to face head on, and I can see it from the photo that there wasn't that asymmetry that used to be there. And for me, that was like the big hello. It's like, hello, there you are.
Aw, I
Yes.
love that so much. And look at you have such a beautiful smile,
So
and
great.
you are stunning to begin with. I tell everybody, you know, we're not trying to make you look like someone you're not. We're not trying to, literally, we could care less. We thought you were beautiful to begin with. I mean, and I wanted your hair from the get-go. But I think that this was something that bothered you. And if we were able to fix it, why not? Also irritated me that this was not something covered by insurance. You were born with this. If you were born with anything else, they would cover it. But because this was cosmetic, so that really angered me.
Yeah, I know we had some extensive conversations with that, and I think it was a lot. I think I could have went with anybody, but God just sent you to me in that moment.
Oh, yeah.
And I mean, it was like an angel that came down, and I just felt so confident with you. And it wasn't, you never gave me this unrealistic expectation. You're like, this is a process. We're going to continue to build, have faith in me. And that's exactly what I did. And I just came back as consistent. And it was through communication between, you as my injector and then me as your patient that it really like, and then we started different things because we didn't go straight to the chin to begin with. We first started fixing the asymmetrical lips, and then we advanced to the chin because I was kind of nervous about that, if you remember.
Yes, very. And rightfully so. I mean, it's your face. And I mean, we always say this. You can say to anyone, "Oh, I'm the best at that," or "I'm good at that," or "I can make that better." But you have to really know what you're doing, and you also can make things worse. So, there's been a lot of patients that we've had that have gone to other places, gotten implants, gotten filler, and it may not necessarily be the outcome that they were hoping for. So, I'm glad that you realize that and recognize that Jenna and I try to keep these expectations in check and that we know our limits. And that's one of the reasons why I was so grateful that you were willing to speak to our podcast and our people about this, is because how many other people are out there thinking, oh, well, I don't want to go through a major surgery, or I don't have the money to go and have bone removed or my jaw broken and repositioned, or, I don't want to go under the knife. I don't want to go under anesthesia for these things. But I mean, it made an impact on you to the point where now you're changing the way you take pictures and the way you see yourself in the mirror. And like, I just think that that's such a great thing. And so I want people to know that this is an option for them,
Yeah, definitely. I think a big thing too, for me as a patient, when you think of somebody who's going to get lip filler, you think, they're just going to put a bunch of lip filler in your face and you're just going to be swollen. And for me, it was very gradual and it hasn't looked abnormal. Like nobody can really tell that I've had anything done with my face. And it wasn't like when I went to you guys, it wasn't like I'm going to put 1 milliliter syringe, 2 milliliters. Like I hear a lot of my friends say when they get lip fillers, they just go for a 1 milliliter automatically. It was never like that because it was more about building that tissue and building that pocket and making sure it was sustainable. And that I respected, honestly.
Well,
That,
thank you.
and I would say we really pay attention to how you're moving and how,
Yeah.
your structures are just at your baseline
And
too.
we
So
actually had to have that conversation a couple times because when you would smile, certain areas would lift more. But I would say to you, these are the options. You can either have it, perfect when you smile, but it's going to be a little bit bigger when you're at rest, or we can have it kind of even here, but when you smile, it is going to pull up a little bit more on that side. Which way would you rather have it? We discuss it. We try to simulate it so you could see what we were talking about. And then also do it in a stepwise manner so that it didn't cause permanent damage, because if you wanted this reversed at any point, I didn't want to have stretched the tissue too quickly or too fast, improperly, and not have it be able to be reversed, because that's always important to me, that this is your face and what I see subjectively may not be what you see, and the things that I think are beautiful may not be the things that you think are beautiful. So I always want to make sure that we're checking in with the patient and making sure that you're comfortable with it. And I remember you were like adamant at the beginning. You were like, just my lip. And I'm like, are you sure? And you're like, absolutely. And I'm like, okay, then we won't even talk about that. And then I think you brought it up one day and you were like, actually, what could we do? And I'm like, oh, well.
Yeah, we had like a pre-conversation many times of what types of fillers, long-term fillers, short-term fillers that we would do in that area. And then ultimately we did decide on a specific filler, and that's what we've kind of been doing. And honestly, I mean, how long ago was the first time? It was well over a year ago.
We're so grateful for you sharing your story. You look
Yes,
absolutely
thank you.
stunning. We appreciate everything you do and the support that you have for the Cosmetic Queens. And now we're hoping that other people apply for the foundation for things similar to yours.
Yes, I think it's wonderful. Honestly, what you guys are doing is amazing. There's never been a time that I've walked in. I won't go to any other filler. I will travel all the time. I wait for my birthday every year whenever I decide to come out. And I just I don't trust anybody else, because we've built that bond, we've built that relationship, and my baseline. So for me, I'm so grateful to have found you guys, honestly. And I remember when you guys first originally left where you guys were at, I followed you because that's just the relationship that we built. So,
Well, thank you.
Thank
We
you.
appreciate you so much. And thanks for joining us today. We love you.
Love you.
Bye.
Thank you.
So we have one more guest that is very special to us. We love all of our patients, and I couldn't pick a favorite if you told me to, but I feel like we get these patients and we create such a bond and such a close connection with them that they do become truly family. So this is like one of our sisters. She is always goofing around with us. She's always sending us inspiration on what to do on our
Instagram
content. She supports my Labubu craziness, and she's always here for an update on my crazy dating life. Her name is Candace. She's absolutely amazing. She works with us at Inspire at the Granary. And she wrote this because she's actually on vacation. And I said, enjoy your time there. So she said, I'm someone who has experienced the generosity and love of the Queens and the Sparkle Box. At the time, I was not a longtime client of the girls. It was maybe my third session. And when I walked in, I was very heavy with the weight of what I had been going through. I had lost my oldest son a few months before my appointment. I just was emotionally and physically drained. I had no intentions of sharing anything personal when I sat down, but as soon as Jena looked at me, she could tell there was more going on. I said, I just have been through a lot in the past few months, and I need everything to make me feel not horrible every single day. She looked at me, really looked at me, and said, okay, but what's going on? Talk to me. And I hear Jena and I saying this repeatedly, over and over and over again. We're like, yeah. We know that you want to look less tired. We know that, you want to fix this. We understand, but what's going on? Because it's like we just know. We have this
feeling.
weird empathy feeling, and we just know, and we want everyone to know it's a safe place and that it's okay to share whatever you're going through, because we can take it. And like, we've worked on being able to process all of these things and take on these feelings and emotions and help you navigate them and come up with solutions, or just be a listening ear. And so she said, I broke down and I shared my story. She left the room and then came back. And this is not in here, but Jena, what she was doing was she was leaving the room because we make decisions as a team. And so she wanted to know if she could take the treatment from the Sparkle Box, because there was somebody there that needed it. And obviously, our response to each other is always pretty much the same. You don't even have to ask why. Of course, absolutely, 100%.
Get out of here.
What can I help? Why are you even asking me this? Of course, you know the answer is yes. So she went back, and after my service, when I went to pay, I was told that the Sparkle box knew that I needed something special and that I was chosen to be that special person that week. They gifted me with my services, and I was slightly emotional in the office, but very thankful. And then when I got into my car, I completely broke down at the generosity and grace that was given to me. It made me feel a little less alone and realize that the world is not as dark of a place as I felt at that time. These girls will always have a special place in my heart. They're not only my aesthetic providers, but they're my dear friends, and I'm thankful that they're in my life every day. So the point of me telling you guys this is not so that you think that we're these great people. The point of me telling this is so that you can get the word out that we can make a difference in the loved ones that you have in your life. But we can't do that if we don't know. So if nobody tells us someone's suffering with something that we can fix, then how would we know?
Sure.
So we have had people who have had neck radiation that couldn't swallow. We've done laser procedures with improvement. We've had people with dog bites that we've helped, remodel. We've had congenital birth defects. We've had domestic violence survivors that nobody wants that constant recognition.
Right.
So I think, we've had people who have lost their husbands, their sons, their children, just unfathomable things that you're like, why would I call the Cosmetic Queens?
But it's not just about beauty.
It's not.
Yeah.
It's
It's about giving back for us, but it's for the patients at least, is just feeling a little bit more like themselves.
correct.
I think.
And I mean, her whole world was rocked. I mean, how many patients have we seen who have lost loved ones? A mother, a
Countless.
brother, a sister, child.
Yeah.
It's unfathomable the pain that they're feeling. And it takes an emotional and a physical toll on them. And if we can help ease that just a little bit by making them feel a little brighter, a little bit more themselves, a little bit more closer to normal. I mean, we've had people who have witnessed terrible, tragic things happen and had post-traumatic stress from it.
Yeah.
I mean, our patients become family, and so we want you to get the word out about this foundation. We want you to share this. We want you to apply, and we want you to donate money to it because we think that this is really life-changing. So thank you to everyone who shared their stories.
Yeah. Starting January 1.
January 1,
Join
2026.
us on our Instagram, our Facebook. You can make a difference too. And we'd love for you to make a difference.
Cut to commercial.
Cut to commercial. Thank you for listening to the Cosmetic Queens podcast.
We love you guys.
We love you.
Bye.